My name is Dr. Abinasir Amin, and I'm the resident technical advisor for malaria M&E.
So as the technical advisor for malaria M&E, what are your responsibilities? How do you contribute to the team here?
So my responsibilities actually are very broad, unlike I think some of the other positions which are very focused on specific aspects of technical assistance. I've actually been employed as a malaria advisor to our client, the Division of Malaria Control. So even though I focus on monitoring and evaluation activities as our core mandate as measure evaluation, I also sit in there as a broad malaria advisor. So for instance, my background as a pharmacist and as a health worker is in case management. So how do you effectively treat malaria when somebody has malaria? So those skills from my pharmaceutical background, from my health science background also come to bear. So I find myself doing much more than M&E. So I'm part of the case management technical working group, for instance. The affordable medicines facility, malaria, for instance, which is now being implemented in Kenya. I find myself in such working groups as well. Indoor residual spraying, anything to do with malaria, even though I try to focus my time on M&E, so but in a nutshell.
Let's talk about research and malaria. Mm-hmm. What has research shown us in Kenya? What are the trends right now? What has research taught us?
What research I think has shown us more than anything else is that if there's a concerted effort to control malaria, not just in Kenya but anywhere in the world, actually you can save lives, you can reduce the incidence of malaria, you can prevent preventable deaths, because malaria is an infectious disease, and like any other infectious disease, it's eminently preventable, and once you get it, it can be cured, more importantly. So we have the interventions to prevent. So we have long-lasting insecticide-treated nets to prevent malaria. And once, unfortunately, if a child, for instance, has malaria, we have now effective drugs, which are like the ACTs, artemisinin combination treatments, which we did not have about 6-7 years ago. We didn't have that because all the drugs that we had were failing, for instance, sulfadoxine, pyrimethamine, and before that, chloroquine, both of which became ineffective for the treatment of malaria. So unlike a decade ago, I think we're in a much better place to prevent malaria and control, and I mean cure it once somebody has malaria.
How do we know we're in a much better place?
I think we know this from lots of different sources. So Kenya, for instance, has invested in M&E systems for a very long time. Health information systems, before then, I think there's been a lot of sort of skepticism about health information systems for a very long time. The data is not reliable and whatnot. So, for instance, when Kenya signed up to the rollback malaria movement in 2001, I think, that's when we had our first national malaria strategy. We invested in sentinel districts and communities, looking at the rollback malaria indicators of access to treatment, use of bed nets. All those indicators actually are on an upward trend. So access to treatment is much higher than it was back in the day. Net use is a lot higher, almost 50-60% among the really vulnerable groups. Kenya is in a unique place because we started off by targeting interventions first to the vulnerable groups, understandably because of not enough resources to go around. But now we've scaled up and we are talking of universal coverage of all interventions. So use of bed nets, access to treatment for everybody, an emphasis on diagnosis such that you're targeting the treatment to those who only need it. So if you look at all those indicators, they're all on an upward trend. And if you look at mortality as an indicator, the traditional indicator we use is all-cause under 5 mortality. And that has been on decline. And I think actually infant mortality and under 5 mortality both have gone down. If you look at the Kenya Demographic Health Survey 2003-2004, and you compare that with the 2008-2009, which is the last mortality data point that we have, there has been a substantial decline in all-cause under 5 mortality. And many people attribute that to child survival interventions. And the primary one, of course, is malaria. There's been a lot of focus, a lot of money with the Global Fund, with the President's Malaria Initiative, DFID, which is now UK Aid, has invested substantially in malaria control, and we are reaping the benefits of that, and the data is there to show that. Yes.
Let's talk about the data that's now available and the strengthened M&E system. Can you talk about what improvements you've seen specifically in the M&E system? What type of investments have been made in the M&E system, and maybe how you contributed to strengthening M&E?
Okay, so I think my part in strengthening data actually is very small.
Okay.
I wouldn't take credit for any of that.
All right.
It's a national effort. The unique thing about malaria control, I don't know about other disease control efforts, is that we really believe in the rollback malaria partnership model. So at the global level, there's rollback malaria, where all partners play to their strengths, and it's the same fight that we're involved in. So at the national level, we try to replicate that. We work through, like I said, technical working groups where the donors sit, implementing partners for USAID and non-USAID funded programs. We all sit around the table and we try to tackle whatever is on the table. In terms of broad trends of strengthening M&E systems and health information systems, I think initially there was a focus on using sentinel data for malaria control because there wasn't much else going on. The health management information system, like I said, there was a lot of skepticism about the reliability of HMIS data. Things like the quality of the data, the timeliness. You want to make a decision, you never quite get it when you need it, so you just move on, you make do with what you have. And I think actually that's what inspired the setting up of the Sentinel districts for malaria. We had 5 Sentinel districts, and we were using that to monitor and evaluate malaria control programs for a very long time, until I think 2009, when the Division of Malaria Control underwent a malaria program review, and they decided Sentinel site data was not the way to go, and we should invest more in national health systems. And in line with that, I think for malaria, PMI has been investing a lot of money in monitoring and evaluation. So before the measure program, PMI invested through MSH in strengthening pharmaceutical systems program, mostly on commodity data. And before then, as you are aware, USAID has also been investing in monitoring data. So before PMI came on board, we had JSI Deliver, I think, program, which used to work with the Kenya Medical Supplies Agency to try and track reproductive health products, blood safety products. And when we came on board, PMI also invested some money to strengthen the malaria components. So I remember 2008, 2009, there was a lot of activity in looking at the malaria registers. How do you track the commodities? How do you respond to some of the Global Fund indicators that we are being asked to monitor? And obviously, the Global Fund obviously has been a very big investor in health system strengthening, and also and by extension, HIS. I think the other investment of late, obviously, is USAID. I think about a year and a half ago, there was a big sort of evaluation which was done by USAID. There was a mission to Kenya, and they talked to all the partners. And from that, obviously, Afya Info project has come in a big way, trying to fix some of the issues with HMIS, at least from the supply side. How do we contribute as measure? Obviously, when you talk of data, there's the supply side, which is what Afya Info is working on, but there's also the demand side. So once you have the data, unfortunately, I think for a very long time there has been the focus on just reporting to a donor. The donor wants the report, it's end month, and they want to know how many cases of malaria you've treated with donor-funded ACTs, for instance. So we're trying to change that culture of reporting to the Global Fund, to donors, to government for performance appraisals, and much more to what does this data mean? How are you going to use this at your level to make the decisions that you need to make? As malaria, we have gone through a very exhaustive process with the Division of Malaria Control and national stakeholders on identifying what their needs are, what sort of decisions do you need to make day to day and over medium to long term. What sort of indicators do you need? Where are those data elements for the indicators going to be obtained from? what sort of dashboards do you need to visualize, to say, things are going according to plan or not. So we're investing in that through what we are calling, a number of surveillance activities. And right now, actually, as I speak to you, we have a tool for district malaria control coordinators, which is it's called District Malaria Control Coordinators Health Facility Summary Tool, which is a summary of all the indicators which are relevant to decision making for malaria, and how do you use that to collect data, not just abstracting from the system which is there, but also just trying to see if you can do a bit more, given that the district malaria control coordinators also have an M&E function as part of their job description. So that's what we are trying to do, and we plan to have, hopefully going forward, sorts of data review forums. We had the Kenya National Malaria Forum, obviously.
Tell me a little bit about the Kenya National Malaria Forum.
The Kenya National Malaria Forum actually was meant to start, a culture of national dialogue around data and data use and what are some of the issues. It was focused on the needs of the Division of Malaria Control. So what we did was to go through a carefully structured thematic questionnaire. We mailed that to a number of stakeholders, asking them just what are the issues, do we have the data to address those issues, what are some of the gaps. And from that, the feedback we got was really massive. And we sent that, we turned that around as a call for abstracts, and we had people who are the repositories of some of this data or some of this research to come back to us and respond to the call for abstracts. We had a 2-day meeting here in Nairobi, bringing together the policymakers, the researchers who obviously have the data and the skills needed to interpret that, and the malaria program community and all the implementing partners as well. So you can, I see it as, the first step in trying to institutionalize some of these, data use forums. So once there is buy-in and a lot of support at the national level, obviously you can use a similar model, perhaps much more focused on specific issues of the day. So in Nyanza, Western Kenya, the issue might be slightly different. It might be, we have bed nets already in every household, but how do you get people to use it? It can be much more focused, much more thematic. But I think we've sort of set the ball rolling with the Kenya National Malaria Forum.
Excellent. It seems like the forum was a great place to exchange what we know.
It was a great place.
Okay, good. Yeah. Can you tell me, from your perspective, what is the importance of monitoring and evaluation?
I think monitoring and evaluation, without it, then there's really no accountability. You can't really say you've done what you set out to do, and actually what you've done has worked. So without M&E, how would you know that decline in malaria mortality? There is actually a decline in malaria mortality. And more importantly, how do you tie that to the specific set of activities that you did? So it's very much a performance rubric or framework, M&E. And it's something that everybody now, I think, if you asked this 10 years ago, people would probably ask you, what is that? What is M&E? What are you talking about? But now I think it's become so streamlined that people will ask you, what do you mean you don't have an M&E officer? What do you mean you don't know what M&E is? So I think there's been a really massive change. And, if you look at the papers daily, there's, an M&E position, which wasn't the case a few years ago. And obviously there's been a lot of focus on M&E, which has been driven by donors, performance-based funding. Global Fund is one of them. When you sign a Global Fund grant, you don't just say, oh, give me $500 million and this is what I'll do. They'll be like, okay, how do we know that you actually did it? So there's a performance framework, which is a contractual document, which says, I'm going to distribute 11 million nets. How will the Global Fund know that you've done that? There's going to be an indicator that, of not just process indicators on how many nets you've distributed, but actually the intended beneficiaries are benefiting. X number are slipping under nets, whatever if it's pregnant women, if it's children, if the target is universal coverage, so how many people per household actually have access to a net. So it is a performance issue, it's an accountability issue, it's an advocacy issue in the sense that then you can say, look what the money has done. It's saved 100,000 lives in Kenya alone. So it's multifaceted. But in a nutshell, it's accountability, it's performance, and it serves an advocacy role as well. Our biggest contribution right now is probably going to be a slight shift in emphasis from the M to the E. And I'm really excited about it because it's actually in line with a global trend of value for money. You know, it's a value for money proposition. So what, you've distributed 11 million nets. What is the impact on lives saved? What's the impact on mortality, on disease incidents? And I think we're in a very good place as malaria to answer those sets of questions. We're in a very good place as a program because obviously, you know, we are also, there's been a lot of investment, like I said, USAID and all sorts of partners investing in the M and systems to get the data that you need to answer the E. So I think we're in a really, really good place as a project. As also malaria community, by happy coincidence, there's lots of evaluations which are going on by the Global Fund. They want to know, we've been funding malaria control programs for the last 10 years. Global Fund, I actually celebrated its 10th birthday, I think, about a month ago, because it was started January 2002. And they would want to know, you know, and PMI invests $40 million, I think, in Kenya every year. So they would want to know that so what question. And actually we are slated for a PMI impact evaluation, I think, a year from now. And I think obviously we're the natural partner to go to answer that question. So very exciting.
Where are we the natural partner to go to?
I think we're the natural partner to go to because of our global reputation. We are feeding off that reputation. And I think in the country level, we established ourselves as, you know, very resourceful TA, very responsive to the needs of our client, the Division of Malaria Control, our donor, PMI, and to the stakeholders. They know that is our strength, and I have no doubt that they'll turn to us to answer that so what question when the time comes.
Excellent.
Yes.
Thank you so much.
Thank you very much.